Hello, my name is Kimberly Rush, and I am presenting on Chapter 4 of Ramachandran's book, Phantom in the Brain. My topic is on echinotopsia, which is otherwise known as motion blindness. So what is echinotopsia? According to the new study, motion blindness is a failure of the brain to make use of two kinds of binocular cues, called changing disparity and interocular velocity differences. There is no physical problem with their eyes at all, according to Rokers. This is a statement by Barnard, 2016. In other words, echinotopsia is a rare disorder where the individual is unable to perceive visual motion. Some general information is that the experience of echinotopsia may be similar to that of a strobe light, seen in the picture to the left. Causes are a result of stroke, traumatic brain injury, Alzheimer's disease, and typically brain lesions. As of now, there are no known effective treatments or cures. Ramachandran indicated that patient Ingrid had bilateral damage to area MT and as a result developed echinotopsia. The most common region affected is V5, or MT, and the temporoparietal occipital junction, which are Brodmann areas 19 and 37. There are two forms of echinotopsia. So there's inconspicuous echinotopsia, which is perhaps the most common form. This is where you experience snapshot-like experiences. It often occurs with palinopsia, which is after imaging and visual trailing. It can be linked to prescription drugs such as antidepressants and even LSD. Hallucinogenic disorders and persistent aura without infraction. Inconspicuous echinotopsia can also be temporarily induced by transcranial magnetic stimulation. On the other hand, gross echinotopsia is a type that patient LM experienced. I'll be talking about her in the next slide. Gross echinotopsia patients cannot perceive gross motor movements such as lip reading or altering facial expressions. They report here and then there experiences and jumps and gaps in movement. And they cannot detect speed of motion or direction. Current research suggests that there is a potential connection to Zeitrefer phenomenon, which is the speed of moving objects or time speeding up. Patient LM highly contributed to our early understanding of this disorder. It was determined that her motion blindness was both specific and selective and not due to any other dysfunctions. It was strictly a result of bilateral injury from a posterior brain hemorrhage. She had difficulties with shaking hands, crossing streets, filling a glass full as she could not detect rising. Direction of movement, fast objects seemed to jump rather than move, or altogether they disappeared. And as a result of this, she developed extreme anxiety. Therefore, she adopted multiple coping mechanisms. In the case study I read, they did tests including ocular motor scanning patterns, reading eye movement, stimulus velocity, and compared her performance in a motion coherent task with that of an MT lesion monkey. Because there is no known treatment or cure, she trained her hearing to determine distance. Lastly, these are pictures of perception that echinotopsia patients may experience.